We'll get underway. Hello, I'm Dr. Kerry Forrestall. I'm the president-elect of the Maryland College of Emergency Physicians, and welcome to our first of what hopefully is many quarterly town halls. I'd like to go around the room and have people introduce themselves, starting with our current president.
Good evening, everybody. I'm Michael Bond. I'm the current president of Maryland ACEP and currently working at a community hospital in the Baltimore area.
Our executive director.
Good evening, everybody. I'm Adriana Alvarez, Executive Director for Maryland ACEP Chapter.
All right, our SAGE counsel.
Hi, I am Dana Kaufman. I'm with the law firm of Schwartz, Metz, Wise, and Kaufman, and I provide legal and lobbying services to Maryland ACEP.
Who is one of our main panelists tonight, and Dr. Reginald Brown.
Good evening, Dr. Reginald Brown. I lead the Maryland chapter ACEP's public policy and advocacy efforts. Thank you for having me tonight.
Thank you both for being here. So we're going to jump right in. We're trying to keep these town halls to a minimum time to be respectful. So Dana, if you would take it away. Dana, would you take it away?
Sure. So I'm going to share my screen right now. The purpose of my call today, or my part of this event, is to give you a little bit of a background of what's happening in the General Assembly right now. As you know, we are in our 90-day session. I think we're around day 35, maybe a little bit under of the 90-day session. So we only have that many more days to go, but we really are in the crunch time, where the committees are really focused on moving bills out of their committee. 3,006 bills were introduced this session. The number one issue, if you watch the news, you would not be surprised, is the state of the Maryland budget. We came in this budget with a $3 billion deficit to close. So that has been really at the forefront. So Maryland ACEP basically looks at the budget, but then we also track a couple dozen bills. So I just wanted to give you an overview of some of those higher level bills to give you an example of what we're tracking, but this is not inclusive of all the bills that we're tracking. So the first thing I wanted to talk about was the proposed fiscal year 2026 budget and the E&M code, or the E&M payment rates for Medicaid. When we left last session, those E&M payment rates were at 100% of Medicare for Medicaid rates, but in October, they were reduced down to 98%. The governor's budget, Governor Moore's budget, did increase those rates back up to a little bit over 100% of Medicaid from the 98%. So we were very excited to see that in his budget. Unfortunately, the Department of Legislative Services has recommended that those remain at 98% as one of the cost savings initiatives. So MedChi has put out a broader physician alert to please contact your legislators to maintain the rates at 103 or a little bit over 100%. They're about 103% right now. One of the main reasons for that too is just that we have such a high Medicaid population that we want to make sure that Medicaid providers or the physicians can stay in the Medicaid program, which again also helps to make sure that individuals are not uninsured and end up in your emergency departments. So that's one of the big issues for the budget. To go down some of the bills, and I'm going to try to put them in blocks of kind of subject matters. And again, these are just some examples of some of the bigger bills that we're tracking, but it's not. But there are many other bills that Maryland ACEP is also tracking. So the first bill I just wanted to talk to you about was House Bill 418, Senate Bill 437, HMOs, payments to non-participating providers, reimbursement rates. This is really looking at how we can increase the statutory reimbursement rate for HMOs when you're a non-participating provider. Right now in law, there are non-participating provider rates for HMOs and PPOs, but as everyone knows, Maryland has very low payment rates. So that's kind of a bigger issue going down to this. So Maryland ACEP does support this bill and trying to increase those rates. So that's a work in progress. The next bill is Senate Bill 776, House Bill 995. It's a work group to study the rise in adverse decisions in the state healthcare system establishment. Like the name says of the bill, it does establish a work group. This really came out of the fact that Maryland does have a pretty robust, what we call appeals and grievance law, when there has been denials and insurance carriers have to, insurers have to report their rates of denials to the Maryland Insurance Administration. But what we're seeing is issues between what is being seen by the provider community and then what is being reported to the Maryland Insurance Administration. And one of the biggest issues is the level of denials that are occurring within the emergency department that's not reflected in the rates of denials that are being reported to the Maryland Insurance Administration. So this work group is supposed to be looking at that and trying to streamline and make changes to the denials as well as the reporting of those. The next bill, just to let you know, is House Bill 1301. It deals with transfers to special pediatric hospitals, prior authorizations, and it basically would prohibit both in the private market and in the state programs from requiring prior authorization for a transfer to a special pediatric hospital. I did read today that about half of the MCOs in the state already have gotten rid of the prior authorization, but others still require it. So that's another bill that Maryland ACEP supports. There are a couple bills dealing with medical malpractice. The first bill is House Bill 113. This bill does not right now apply to medical malpractice, but the physician community, including Maryland ACEP, is very much opposed to this bill. It removes the cap on non-economic damages for personal injury and wrongful death. And of course, our concern is that that will impact and MedMal will be the next one that they come after for removing the non-economic damage cap. So we've been fighting that bill. Another bill is House Bill 1099, Civil Actions, Punitive Damage Awards Surcharge. This literally puts if you receive a punitive damage award as a defendant against you, this puts a 50% surcharge on that award that will go to fund education, Maryland's blueprint. There's also some changes regarding the standard that will be applied in a civil action. So Maryland ACEP also opposes this bill. This bill has not yet been heard before the General Assembly. It'll be heard next week. And lastly, again, being heard next week is, long ago, I think it was 2001, there was the bill that created a catastrophic health emergency, I guess outline, not realizing that one day we would have COVID, and it provided immunity for healthcare providers. And this bill basically would repeal that immunity from civil and criminal liability for healthcare providers acting in good faith under a catastrophic health emergency. And again, Maryland ACEP opposes. And then just real quick, there's a couple other bills just to let you know. House Bill 867, State Boards of Physicians, naturopathic doctors, they want to now have prescription authority, including opioids. So Maryland ACEP opposes that. There was another bill, Senate Bill 447, hospitals, emergency medical conditions, procedures, that would codify some of the provisions in the Federal Emergency Medical Treatment and Labor Act, EMTALA, into state law. There have been discussions ongoing to narrow this bill only to reproductive health because we don't want to have duplicate laws, but more of duplicate penalties as well. Another bill, Senate Bill 720, House Bill 905, which has passed the House Health and Government Operations Committee, does require non-state-owned hospitals to establish and maintain a clinical staffing committee for developing a clinical staffing plan. And then lastly, there's a bill that will be heard next week that has been in several times, House Bill 1308, that makes it a felony to commit a crime of violence against a person in a medical facility. And that it would be imprisonment up to 10 years. So it's an enhanced penalty. So again, those are some of the issues that we're looking at, or bills that Maryland ACEP has weighed in on and are tracking. We do have calls every Monday at 1 p.m. So we encourage everyone to join us for those calls. That's when we kind of debate debate this legislation and decide which bills Maryland ACEP is going to weigh in on. So I guess that kind of sums up my part of the presentation.
Carrie, you're muted, but thank you so much for that summary. I'll just add before Dr. Forrestal gets back on is that we really need others to help us with this. The legislators really do listen to their constituents. So if there's a constituent where your hospital is and or where you live, please reach out to them. Even more importantly, in the off season, over the summer months, let them know your feelings about certain bills. Some of them won't make it through our legislature this year, but they'll be back on the docket next year. So to quickly summarize, Maryland ACEP's trying to prevent scope creep with naturopaths having prescribing rights. We're trying to make it so that non-economic damages or punitive damages don't increase in medical malpractice lawsuits. We're trying to protect you with workplace violence by having stronger penalties with people that decide to act out. And we all know about violence in our workplace. And then Maryland ACEP led a delegation with Senator Lamb to change the EMTALA provisions that he was going to try to get passed. Basically, we would have had a federal and state EMTALA as initially planned, but after meeting with him, we're able to get to the fact that with the current federal changes in effect, he really wants to just protect women and their reproductive health. So this law is being narrowed down to only do that depending on what changes at federal levels. I'll go to the others, but lots of work being done to try to protect how we work in this state and to protect our patients.
That's a perfect summary, Michael. Thank you. And Dana, thank you very much for an excellent roundup. Does anybody have anything extra to add? Are there any big points to bring out?
Yeah, I just wanted to echo what Mike said, and the malpractice attorneys and the insurance carriers are well represented and strongly advocate for themselves in front of Maryland Assembly as well as federally. And it's so important. The crux of our conversation is to encourage other Maryland ACEP members and other physicians to come to the table in support of these initiatives. Your time, effort, and sometimes dollars are critical to us practicing in a safe environment, being compensated fairly. I'll add one last plug that nationally ACEP has the Leadership and Advocacy Conference here in DC. So it's not far from most of us in our Maryland homes to go back and forth or stay down in DC and learn more about how you can be an effective advocate for our practice and for our patients.
Excellent. Well said. And Dr. Brown is our leader of legislative affairs for the chapter. Our next quarterly meeting will be regarding the national ACEP meeting, where we hope to set policy for the organization. Does anybody have anything else to add? These are going to be short and sweet town halls. We do not want to be taking a lot of your time, but we do want to allow for people to participate. Anything else?
We want to plug the Maryland Education Conference coming up as well, March 27th at SMC.
Yeah, so we have a one-day conference with, you can get 6.5 hours of CME. And then there'll be a national ACEP update if you're interested in that. And plenty of people to talk about if you have any public policy agendas. The other thing I just want to add is feel free to reach out to us at info@marylandacep.org if you have things that you're passionate about that you think that we should be taking to the legislator. If you have good stories, Dr. Forrestal is going to be testifying in front of our legislator about workplace violence, and he has a couple of good stories, not good stories, actually horrible stories, but that talk about workplace violence and the effects they've had on people. But if you have additional stories, those are really helpful in swaying the legislator to take on these challenging issues.
Carrie, whenever you do that, if I'm free, I'd love to come because, that's one of the things that I'm very interested in. And plus my colleague, Eric Shobitz, who used to be the PIM rep for ACEP probably about 5-6 years ago, He's down in Virginia, but is also trying to work on getting that done as well. And actually just recently went to the Washington Post. Then they may have an article coming out featuring him.
Yeah, I've been in contact with Eric. He sent me the laryngoscopes or the bronchoscopes, bronchograms of what exactly happened to him. So yeah, I've been talking to
Fantastic.
Eric
I'm glad to hear that.
quite a bit. He sent me all the images. They're quite interesting.
But a
All right.
lot of the change that will happen in our legislature really does take from grassroots efforts by having these conversations now and in the off season. Everybody needs to remember that our legislator is actually like a part-time legislator. They're in Annapolis for 3 months out of the year, but a lot of the real work and lobbying for bills or trying to get bills written is done in the off season when they're not in Annapolis. So if there's things that you're passionate about, please reach out to your local delegates.
All right. Very good. And with that, we're at 17 minutes. And thank you all for attending.